So here we are at the San Francisco Ocean Park Aquarium, and the first group of flukes we're going to discuss is schistosoma, which causes schistosomiasis. Say that 10 times fast. In general, schistosoma have free-living cercariae that penetrate the skin, usually in an aquatic environment, and enter the bloodstream. So we'll have a swimmer here in this aquarium to remind you that swimmers are at risk. And you'll see why this guy's swimming in the tank in a bit. After gaining access to the bloodstream, they're then carried to the liver, where they mature into adults. These adults will lay their eggs in the humans. The humans like to poop and pee a lot, and we especially like to do it in water sources. And then snails, swimming around in these water sources that we poop and pee in, are exposed to the excrement and become the intermediate hosts. So we'll draw a couple of snails stuck to the glass here and there, and that'll remind you that they're the intermediate host. Now, once the adults have matured, and where do they mature again? That's right, the liver. They like to migrate to other parts of the body. Where they migrate depends on the type of schistosoma, of which there are 3 important ones you need to know: Mansoni, Japonicum, and Hematobium. So once they're in the liver, how do they spread to the rest of the body? Well, the logical flow would be to go up the hepatic veins, ride downstream, and go to the lungs. However, these schistosomas are kind of like salmon and prefer to do it the hard way. All 3 of these adult worms will migrate against the portal flow to reach their venous destination. So to illustrate this concept, let's draw this porthole here, which should remind you of portal blood flow. Inside the hole, we can see this awesome and familiar piece of coral. Notice how it's shaped like a liver, and the roots of the coral also somewhat resemble the portal veins. Now we'll draw in a school of bluefish to represent venous blood, and they're swimming toward the coral, as in the normal flow of blood through the portal veins. However, when infected with schistosoma, the worms move against it, and hence we'll draw in 2 red-colored fish going in the opposite direction. And these fish are oddly shaped, aren't they? Well, they're going to represent 2 of the types of schistosoma, and that's Mansoni and Japonicum, both of which cause similar symptoms. Now, the first 2 words that pop up when you hear these 2 types of schistosoma are probably Manson and Japan, right? Well, to keep things a little more PG, let's go with Man and Japan. So both of these flukes like to reside primarily in mesenteric veins. Mansoni will be illustrated by this statue of Merman back here, and Japonicum will be represented by these Japanese tourists looking in. See the Japanese flag that the tourist is carrying? Okay, so we have the names, but why do the fish look so weird? Well, we tried to draw the fish similar to how the eggs of the worms look. More specifically, how the spine of the eggs look. Mansoni will have a large lateral spine, which is a buzzword. And you can see that the red fish next to the merman, and the merman himself, have big pointy dorsal fins. This will remind you that the spine comes off the side of the body, and is hence lateral. So Japonicum is almost as smooth and as round as the red sun on the Japanese flag. So this should help you remember that the spine is really small, or almost absent. So these eggs can be seen on a stool O and P, so checking out the spine will help you distinguish the 2. Alright, so we've talked a lot about what these 2 schistosoma look like, but what symptoms do the worms actually cause? Well, all 3, including Hematobium, which we'll discuss next, causes a swimmer's itch where the larvae penetrate the skin. So just remember our swimmer in the upper right-hand corner, and you should remember swimmer's itch. Chronically, Mansoni and Japonicum, which are pretty active in the portal system, will cause portal hypertension, which can lead to GI hemorrhage and abdominal pain, and can eventually cause cirrhosis and liver failure. We'll add a crack to the porthole from the high water pressure in order to demonstrate portal hypertension. And the fibrotic-looking coral that's shaped like a liver will remind you of cirrhosis. And on that note, let's give our Japanese dad a nice jaundiced-looking yellow coat. Okay, let's move on to our 3rd and final schistosoma, and that's Hematobium. Now, this fluke likes to reside in the veins of the bladder, so you can imagine that it would cause bladder-related symptoms. These worms will be illustrated with these red, roundish swordfish, because, like you may have guessed, the shapes of the Hematobium eggs have a large terminal spine that can be seen on stool O and P. So remember, if you see a spine at the end of the oval, like a swordfish, think hematobium. Side spines are Mansoni, so keep that straight. Anyway, these two are also swimming against the school of blue fish to remind you of the migration against portal venous flow. And the symptoms this worm causes is primarily hematuria. However, it's also associated with bladder cancer. So here, we're going to have our hematobium swordfish be piercing a jellyfish that looks like a bladder to remind you of hematuria. See how the jellyfish is kind of bleeding? And the other swordfish is piercing a crab, which is, of course, a recurring symbol for cancer, to remind you of the risk of bladder cancer. So to prevent the progression of disease to cancer, it's important to treat this as soon as possible. The treatment for all three, and incidentally for all trematodes, is going to be praziquantel. If you watched our cestodes video, do you remember what the symbol for praziquantel is? It was a pretzel. So we're going to draw that in the aquarium here. And now you know the reason why the swimmer dove into the tank, to get his fallen pretzel. Well, enough with the schistosoma worms. Let's move on to Clinorchus sinensis, otherwise known as the Chinese liver fluke. Now, the host of these worms are snails again, so let's migrate to the other side of the aquarium and draw in a couple snails here and there. And the star of this part of the ocean park is going to be our orca, which should remind you of Clinorchus for orca. Now, these worms are transmitted from the snail host to the fish, which we humans tend to sometimes eat uncooked, like maybe in sushi. The encysted larvae in the uncooked fish will then mature inside of us and reside in our biliary system. Eventually, they'll cause biliary tract fibrosis, pigmented gallstones, and may even progress to cholangiocarcinoma. So to illustrate all of this, we're going to have seagulls represent the gallbladder. And see how this flying gull has a rope dangling down? That fibrous rope hanging off the gallbladder should remind you of biliary fibrosis. And looky here, the crab is grabbed onto the rope, and that crab will symbolize cholangiocarcinoma. Yep, this is all part of the show. Trained seagulls and crabs. And we'll also draw in some black rocks here to the left of the tank that a seagull is sitting on to remind you of pigmented gallstones. Now, just like the schistosoma worms have distinct looking eggs, the Clinorchus trematode also has a particular looking egg, and you can see these eggs here that have tumbled out of the bird's nest, and these are what the eggs actually look like. See these little yarmulke type hats on them? Well, they have a term, and it's called operculated. So this is what the Clinorchus eggs will look like on stool O&P. And lastly, what's the treatment for Clinorchus? Well, as I said, for all trematodes, it's pretzels. praziquantel. We'll draw in a pretzel here in the corner, one that this seagull has found for lunch. Okay, let's wrap up the trematodes by talking about Paragonymous westermanni, a type of lung fluke. So to keep our aquatic theme, Paragonymous sounds kind of like penguins. So we're going to have a small penguin exhibit here at the top. And notice how our penguins are mostly black, but they have two white large lung spots on their chest. And then they even have a couple blood spots on them. This is because the lung fluke has the potential to cause chronic cough with bloody sputum, especially if the parasite load is high enough. The intermediate host is still a snail, which is why we're drawing some on the glass exhibit. And so you've noticed that snails are everywhere, so they're the intermediate host for everything. That's easy enough. So just remember seeing these little guys. We tried to make them pretty obvious. Anyway, this fluke is transmitted through the consumption of raw or undercooked crab meat that carry the encysted larvae. Thus, the penguin on the left is having a crab leg feast. Crab legs because we didn't want you to confuse this with our crab cancer symbol. This doesn't have anything to do with cancer. This is just how we get infected. So when we ingest the larvae, they mature into adults and go to the lung. Diagnosis of Paragonymous is done through a stool O&P, which will show you operculated eggs. So we'll draw in some penguin eggs that also have these little caps on them. The penguin on the right's not eating because she's a vegetarian. She's decided to eat a pretzel instead, which by now you must know stands for praziquantel and is used to treat Paragonymous. Alright, way to go. Lots of bang for your buck in this one. We've gone through all three major trematodes that you need to know. And there are a lot of similarities between the three different groups, right? knowing those will be advantageous since some of the questions tend to group these flukes together. But do remember the differences, especially which worms have the association with cancer. Also remember those spines. So really quickly, Japonicum, small spines. Remember this sun is smooth. And for Mansoni, merman has a fin sticking out of the side of his body for lateral spine. And the swordfish, for Hematobium, has a terminal spine.